way it kind of all started is I got introduced to Dr. Oz and Oprah Winfrey, and Dr. Oz had been on the Oprah Winfrey Show, I think 55 times, and was starting his own television show. And I had not looked at online health in probably 5, 6, 7 years after WebMD. And as we were sitting there kind of brainstorming, saying if you had a blank sheet of paper and you could do WebMD over kind of 12 years later, 10 years later at the time, how would you do it? And it was kind of really shocking to me as I started really looking at it. I was like, gosh, it doesn't feel like anything's really changed, not just with WebMD, but just health information in general on the web. It's still just, a brand pushing information out, kind of in this one-to-many model. But yet there's been all these enabling technologies that have come to the forefront, kind of really led by Facebook. And how could you really start to kind of humanize health and really start to make an impact? And Dr. Oz, I think, is not only an inspiration to me personally, but is really an inspiration to everybody that works at Sharecare.
Well, that's one of the things I like about what we're doing together is in Sharecare, you can get the best content and know that it's been vetted by the real experts, physicians, pharmacists, nurses, people who have dedicated their lives to making sure they know exactly what to do. And then we can combine them with really this next generation of coaches and influencers that we find through our algorithms. Right. So, with diabetes, for example, we can go out and say, here are the top 50 people in order who are driving share of conversation online. And those people have an outsized influence in getting the right content to people. Yes. So we can actually make a difference in how we deal and treat with diabetes, for example. Well, we've developed SharecareNow with Jeff and the team so we can provide the best data to every customer of Sharecare so they can most effectively get their information out. So if you take like a hospital or provider, we can say for a disease, here are the top influencers in order who drive share of conversation. We can then go another step after that and say, here are the top sources for those influencers. Because what we see online is that people generally go to 4 to 5 people as their primary sources when they write content. So we need to know exactly how that is so the company or provider can be the key source and drive flow. Then on top of that, we want to be able to say, what's the language that you should use? So we know that generally about 15 words will drive language more than any others. What are they? Are we using them in all of our content? And we go on and on from there in terms of analytics. The key thing is we want to arm everyone we work with so they can be the most effective to cut through the clutter. And they can make sure their messages truly get across and reach, in the case of America, the 240 million people that are online on a regular basis.
We want to show consumers in conditions that they care about who are the most influential people on the web. Whether they're on Sharecare or not, doesn't matter. Second thing we want to do is that we want to build dashboards out and provide our clients so that they can have the same transparency and insights into the data that we have. And hopefully they'll be able to take those insights and data and they can use some of the content and tools on Sharecare to join conversations. But I think that data is ultimately going to also improve their websites, it's going to improve their Facebook strategies, their Twitter strategies, and we're going to get tighter in our messages and our kind of combined strategy or desire to impact more lives faster than what we have in the last 12 years online.
Think about right now. If we have a conversation right now, it can be very productive, we understand each other, and we go and take action. When we go online, it should stay that simple. And so a company or organization really needs to say, how do I become a relevant peer? And you become a relevant peer by knowing who to speak with, influencers, using the language that they use so you actually connect, knowing where they hang out, because they don't necessarily all want to come to your site. They want you to come to them. They want you to understand what information they want in terms of content. So if you calibrate to the communities that you're trying to reach, you can become a relevant peer and you get as close to a conversation as you can get online. And that's where you start to have breakthroughs, I think.
I think first is to be successful on the internet, it takes a lot of commitment. It takes commitment and great people that know how to build these solutions. It takes a lot of financial resources because, as I mentioned earlier, these sites have to have utility. And so, and they need a strategy, and that needs to come from the top down that says, how do I share care? How do I put accurate and relevant health information out on the web? The days of the destination site are over, right? You have to go where the consumers are at, and you need to humanize it. That's why there's 1.7 million blogs that will be written today. And if you look at like iTunes and the Android, there's already 17,000 apps that are health related in those marketplaces. It seems just like a big number, and it's almost, you're starting to create through these sea of apps the same type of fragmentation. The other thing that you find is that if you look at who's actually making those apps, it's not the trusted brands in health and wellness that you would think should be making those apps.
Right.
So back to the spirit of creating these own WebMDs and digitally activating and being the humble host, it's like, how do we take these brands and say, not only are we going to have you give content, but we're going to help you develop CPR apps and back pain apps that all work together in this ecosystem, and then give collaboration tools that give that feedback back to the provider that shows how their patients are actually doing. And we can do that in the form of scorecards. And I think, who benefits from Sharecare now? Ultimately, with everything we do, we want the patient and the consumer to benefit the most. We want it to be easier for them to find the expert and to be able to connect and take action steps from that. But what I think will happen, like with any time you start to publish data, hopefully that we're going to inspire experts that aren't as active as they could be online today to want to be more aggressive, more active, want to join the conversations and be on these lists. And to do that, they have to digitally commit. And I think, to ultimately reverse chronic disease and to have the impact that the internet ultimately can have, these people have to come online. And so I'm hoping that in a very graceful way that we can nudge these people along so that they want to participate more than they're participating today.
Well, this is why we are also working on developing Sharecare Now, because if you're a customer of Sharecare, you're Johns Hopkins or you're a pharmaceutical company or whoever it is, we want you to have the equivalent of a brain where you can go behind the scenes, password protected, and see exactly what your content you're entering into the marketplace, exactly how influencers are sharing it, and exactly what you can do next to actually make a health difference.